these glasses, these specs you have on.
Ah, thanks. I wish I didn't need them, but I do. They kind of make me look smart. I feel like, thanks.
You don't need anything to help you look smart.
Thank you, Jamal.
So let me start off by saying, and this is my first. It's my first one that I'm gonna upload to my channel. So I had a Zoom party for my mom's 70th birthday on Sunday, which ended up being a success. It was a mess at first, having all family members on there, but it worked out at the end. He was happy. But first I'm gonna start because I heard today. I was supposed to went back to Instagram to make sure, but it's like Healthcare Workers Appreciation Day or something, or Doctors Appreciation Day, or so. I first gotta say I appreciate you chasing that dream all the way to fruition that I once had. So many people start with that dream and all those hurdles that come between, organic chemistry and all the courses that you have to get through to get there, that you had to overcome. I salute you for your stick-to-itiveness and for being able to make that dream a reality, which I know is like a dream for a lot of people and a lot of parents. A lot of parents want their kids to be doctors, and like your parents achieved that with your whole family. So I appreciate all of you guys.
That's nice.
Late Dr. Ross, who set all this in motion, and everybody else. So appreciation to all of you.
Well, I appreciate that, and I just want to say I appreciate you, Jamal, because I don't know if people know, but we went to school together, and I could always, you have to work hard and then play hard. I could always count on you to help me play hard. So I appreciate that. So I never would have made it through without the breaks that I took.
Yeah.
So I appreciate that. So thank you.
And also, and everybody's like, it's the fear is real. Like, it's been so much media attention. I don't know. I mean, when there was a Spanish flu, there wasn't any Twitter or social media or even like networks out there to report all of this daunting news and these statistics that's scaring the heck out of people. And a lot of people are scared. But at the same time, I thought about it this morning. I was like, my dream that I didn't achieve of being like a doctor was all about this moment, about saving 1 million lives or finding a cure or whatever else. So and I feel like at the same time, like this is like an excellent time for all these people that committed their lives to this journey and this profession to really get the self gratification they needed, that they're doing something that's really meaningful. And also I just feel like y'all gonna step up to it. I feel like there will be a cure that's able to be widely distributed. I'm sure there's some cure already out there that's hasn't been through all the phases of tests and whatever else, but it's just a weird time, And one of the things I thought of before we talked, I was like, I remember when we was in our college years, and we would land on a plane, our family member would be there at the gate. And like that never happened again after September 11th. And I'm wondering, like, in the midst of this, what do you think will never happen again because of this pandemic?
Man, I think, first let me just, it's scary. It's scary because on the one hand, we're scared that we may get virus, or our loved ones may get virus, or, this virus is getting to get us, but it's scary too from the perspective of how much of our civil liberties are going to change after this, like look at what's happening in China and a lot of other countries. They have, taking things to the nth degree, you know, cell phone treatment, you know, minute you move your home, someone's at the door telling you, asking where you're going, you need to go back inside. So I think I'm really kind of scared about the backlash from the virus. I'm probably, you know, this is from a healthcare perspective too, I'm probably more scared about the backlash, to be honest, than I am about the actual virus. You know, I've heard people say things like, well, it's just bad flu, you know, how bad can it be? And I mean, this is really something that you do not want to get. But at the same time, from an epidemiological perspective, I just don't see how we're going to get rid of the virus. I don't see that is going to be the solution. The virus is going to be here, and we're all going to be exposed to it in some way, shape, or form. And then you want to be on the right side of that, right? You want to be one of those people who doesn't end up in the hospital, who gets the small cold or has no symptoms. And so from my perspective, I'm so worried about the civil liberties part. So I would say, going forward, I wonder if we'll ever be able to I don't know, maybe even just get on an airplane without a face mask on, you know, just walking in public spaces without worrying about whether you got your mask on and whether you've touched thing, because you know, I don't during flu season, and I would go with a little mask on, but now I believe we're going more like China, where people just walk around with them all the time. So maybe that's the thing I think we'll never get to do again. What do you think? It's a good question.
I think it's the end of the selfies. You know, at least for celebrities and everything else, when people invade their space and be like, you know, let me get all up on you and take this picture. I think we've taken like the last real selfies like that. And I think that would be culturally distasteful after this epidemic, where people will want to be all up on somebody that they don't know and taking pictures. Like, you're gonna have to take a picture of the celebrity over there. You know what I'm saying? Like, let me take a picture, but not let me be like hugged up on you. I think that's and I don't know. I mean, I know there's like all kind of degrees to the Me Too movement, but I think like people being in people's personal space is just going to be a lot more shunned in general, which was part of the issues at the Me Too movement. I know it wasn't the total. A lot of it was pay and opportunities and other things. But I think, like, you know, just the chance of somebody just happenstance grabbing your booty and, you know, just being all up in your space, I think that might be gone. I don't know.
No, I like that. You know, speaking of the selfies, the baby kicked that off. I mean, I think he ended up having to apologize to a man who, and his apology, man, you baby girl, all in my space, you were all in my face. I couldn't, you know, no. So I think, you know, I remember when I saw that apology, I was just like, this is a mess. Why would he even do that? But now you're right. Now we're thinking about personal space differently. Yeah, that's
yeah.
I like it. Yeah.
So I gotta ask some layman questions before I get to the technical questions that I wrote down. Like, just for the basic person, you know, that's on the street, that's dealing with stuff. I mean, you have a family, you have babies around there. What happens with breastfeeding? Is that something that's good or bad during this pandemic? Let's start there.
Question. So far, they don't think that any vertical transmission, meaning transmission from mom to baby. So they haven't really come forward with any declarations as to what you should and should not do in terms of breastfeeding. I would venture to say, you know, if this were my patient and I knew the patient had COVID-19, I would venture to say that at that point we'd probably decide to bottle feed at that point. But, you know, I think that's going to be physician specific. But in terms of someone who, you don't have the virus, you're not showing any symptoms, I think that you know, our advice would always just continue breastfeeding. But I think you brought up a point about breastfeeding, which is great for another video, is that your baby ultimately ends up as toxic as you are. So if your body is harboring a lot of toxins and chemicals and, even Roundup, then that's the number way to pass it to your child is just to breastfeed. So you've asked a great question. And honestly, the thing about the virus is really just don't know. They don't know. One minute they tell you it's not in the air. The next minute they're telling you it is. It's changing so much that it's really hard to say. So I would venture to say that for me, as a doctor, if one of my patients came to me and we knew this, I would say, let's stop breeding for now.
Yeah. I know, why is the touching of the face so detrimental to transmitting the virus? I mean, people touch stuff, if they touch their face, why is that making the virus more potent than just, I guess, touching it with your hands, I guess?
That's such a great question, because the way this virus is getting in, and the way a lot of viruses do, are through the oral mucosa and the nasal mucosa. So particularly the tongue has what's called ACE2 receptors on it. And so that appears to be the way that the virus is getting in, replicating and changing. So the thing about the face is the face is so close to your nose, it's close to your eyes, and it's close to your mouth. All of those are soft, muky types of environments where viruses that's their entry point. So that's why it becomes really important. If it is on your hands and you wash them with that 2 minutes of soap and water, then actually it's not going to get in through your hands, ideally. Now that's what we think. I continue to say that the virus, it seems like we get new news about the virus every day. They're often changing what we think. China's been forthright and numbing about all the information they have. Because now we're learning that healthcare workers are an extreme risk for developing COVID. And some of them will tell you, I've been in town and I've been gloved up and masked up and everything for all this time. So how am I getting it? So I think that there's still some more they don't know about the virus, that hopefully in the coming weeks and days we learn more about it.
Okay, so with all that, I'm sure there's not a lot of answers for this, but people just having their window open on a city block. Can the virus come through the window? I mean, do we know any of that about this virus? Are we taking all the precautions we need to? Do we need to have our air conditioning on when we ride around instead of the windows open or something like that? Do we know any of that information yet about that?
I believe we can extrapolate that type of information. It's the same as, if somebody has the flu and they're your neighbor and they're sneezing into your house, then there's a problem. If they sneeze into the wind and the wind brings it into your house, that's a problem. But what the World Health Organization is saying, and CDC is saying, it's not an airborne virus, that it doesn't stay around in the air long. But I'll tell you, when I have my windows down and pull up to a curb and there's people standing there, I roll them up, and because I have distance between myself and my neighbors, there's certain windows that I can open and certain ones I don't consider opening. So at this point, our goal is to try to minimize our risk of bringing the virus into our homes and around our family and around us, that it is wise to really think through decision opening up your window on a day and things like that. Absolutely. I mean, if you think about it, if someone sneezes at you, and you're sick, you're across there, you'll be like, oh, what was that? It's,
yeah.
So yeah. Risk.
Well, I mean, everybody says, they look at the numbers and say well, the mortality rate is less than 1%. Do you think, as just a medical profession, that we're overdoing it or that we're not doing enough?
I think that it's a little of both. I think the media is overdoing it. I think that they're doing the same images over and over, and then that black and white and red coronavirus, and then they're showing us pictures of New York City hospitals that don't exist, And then when people actually get to the hospital, see all the people, there's none there. So, I mean, I think on the one hand, I think what the media is doing is irresponsible. They're thinking more about the deaths than the recovery people and the survival and the things like that. But I think on the other hand, like organizations like CDC, like I think that it's time for them to make a statement like, well, that everybody should wear a mask on when they're around other people, you know. And I think that until they know a little more about the virus, that we should take general precautions, which is if you're gonna make it inside my house and not to go out for days and days at a time, then can you give me something that's going to protect me when I do have to go grocery shopping, as opposed to just washing my hands. So to me, that's the piece that's not really computing and making a lot of sense. It's like, if you say you don't want us all to have, then why wouldn't you make a statement like, well, let's start covering our face, which is our most vulnerable areas here. So I think there's a little bit of too much, a little bit of not enough going on both sides of the things.
I gotta ask you, as a health professional, because that makes you most at risk, and how do you balance that with having young children in the family at home? Like, when you have to go to a clinic or to the hospital and come back, like what's your whole process?
Sure. So my lesson, and I think that everyone should do this, whether they're going to the store or to the hospital, to the clinic, because your cash could have it, the lady next to you in line could have it. So I think that we all should be taking similar precautions. Is that I have clothes I wear outside the home, and those clothes never make it back inside the home. I have shoes that I wear outside the home. Shoes never make it back inside. So what I do is I'm lucky enough to have like a little office that's away from the home. So I go in there, I take my clothes off, I take a shower. While I'm out, I cover my hair because what I'm finding is that the virus stay on fabric and hair. So, if someone had sneezed in my hair, coughed there, then I'm actually bringing in. So I take all of that stuff off, take a shower, I brush my teeth. I actually gargle with a little hydrogen peroxide, because hydrogen peroxide on oral tissue is shown in some instances to be effective in killing certain viruses. So I actually take that precaution. And then, I feel like I've shed everything, then I feel comfortable enough to go inside of the house. Now, I also know that if I start to ever feel any type of sickness, I start to feel, well, I'm going to mask up in the house, because then I'm like, I don't want to be carrying it and give it to them. And the daily basis is do the basic things to keep your system strong. I try lots of fresh fruits and vegetables. I take vitamin D. I take my omega-3s. So I have a whole regimen that's supportive of having the immune system, because if our immune system isn't right, that's how we end up in trouble if we run into when we the virus. Yeah.
Hold on 1 second. I gotta get to the mobile charge. Okay, before we get into the technical, I gotta get all the theory serums out the way. Can we fix coronavirus?
Can you fix it?
Can we cure coronavirus? I'm going through all the Instagram posts. Somebody said smoking weed fixes coronavirus because of the steam and such and such. Is there any truth to the fact that weed fix coronavirus?
I wish that were true, but there's data to support that theory. There's data to support that theory.
Okay. How about the whole steam showers, like tea? Somebody said in China, the doctor was talking about drinking some sort of wheat grass tea or something, and that this was showing. Is there any correlation between any of these RNA viruses and heat and steam being able to inoculate?
Actually, there is some science back up the theory of drinking warm teas, warm waters, keeping the moisture in your mouth and in your nasal passages. So there is some scientific theory to that. It's not, we don't know, if it's the coffee or the tea or the this or the that. It's actually warm liquids. Actually, the idea behind it, I believe, is that the warmth is actually kills the virus, because the virus cannot sustain in warm environments. So that there is some scientific data to support that theory, actually.
And lastly, and then I'm going to go into my technical outline I have. Why has there at least been reported so few deaths on the continent of Africa compared to the other continents? Is there anything that, does this virus affecting any races differently? Then do we have any breakdown of the racial, I guess, the racial contraction of this disease by race or gender? I've heard some study that men were more dangerous, but I've heard nothing about any racial barriers that might affect.
That's such a great question. And the thing about men more susceptible than women is because the levels of estrogen and actually seem to be protective from getting the virus, opposed to not having estrogen. So of course, since men don't have much estrogen, they're actually at an increased risk as to women for contracting COVID-19 and having negative outcomes with it. But as far as race, I haven't come across any studies because I've been wondering the same thing, like why in Italy, where does it seem like it's been so full? You look over in Germany, Germans seem to be doing fine. And then in Africa, everybody seems to be doing okay too. But here, I would venture to say that in Facebook feed and social media and through my friend mom and mom's uncles, dad's friends, type of things, that to me it seems like it's disproportionately affecting African Americans in terms of hospitalization. So it'll be interesting to see how that plays out. When I originally heard that there was some data to suggest that this virus is worse if you have heart disease, diabetes, asthma. So, those are all the things that we tend to have, hypertension. So I was worried that this would out that way, and unfortunately, it appears to be playing out that way.
Okay, so to the questions, can you explain what is a pandemic and what is the difference between COVID and Ebola and H1N1 or whatever? Like, why does this qualify as a pandemic, or does all of these pandemics?
What tends to... Give me a second. Sorry about that. Let me turn this on. Okay. So basically with the pandemic, it basically means a disease or an epidemic that is affecting the world. And so I think when they originally said that we were facing a pandemic, what they meant that this was going to be a worldwide phenomenon. And basically it ended up being just that. Give me one second. I'm sorry, Jamal. I just got a text message. How long does it live on paper?
Yeah, I mean, you got the mail, and it's all type of points of entry that it seems like it's so hard to break it down. So you have to wonder, like, when I go get the mail, should I leave the mail in the mailbox for 5 days? Or am I just gonna get new?
What I do is I actually take the mail and I spray down. I take the boxes, the Amazon boxes. I wipe those down or spray those down with like a solution, and I don't handle it with my hands. I handle it with a glove. So I think we should be diligent with the mail, because I mean, yes, I think a lot of this was people bringing it to people. I also think that some of it happened other ways. I mean, how many of these corona positive people really traversing these nursing homes like this? I mean, wiping out these poor nursing homes. So I think you have to be that diligent. Let's see, 4 hours on copper, 3 hours in the air, 6 hours on dole. When you think about it, that 2 to 3 days on plastic, that it really makes you think. Like you could be bringing in takeout into your house, never expose yourself to anybody, and still bring the virus into your home. So when you really think about it like that, it's like, okay, so let me try to do things differently here.
Yeah. How often do we have these type of outbreaks? I mean, I can remember Ebola was like near the end of Obama's term, and I guess he dealt with H1N1 also within his 8 years. Is this like something that we expect every 3 years? Should we just expect COVID-19 to come back when it goes away immediately in the fall, or would it be like a couple of years? I mean, is this follow any typical pattern that we could kind of like guesstimate, like how often we'll have to deal with this?
Apparently, this is following the flow of the Spanish flu back in 1919. So now this started in 2019, and so what is this? Though 100 years later, we're dealing with a similar problem that we dealt with then. And that was actually a corona type of virus as well. So I think what we have to keep in mind here is that whether or not this was something that was the Illuminati or whoever else released, or whether or not it was actually something that happened from somebody eating a bat or another type of animal, we have to keep in mind here that there's always the possibility that this can happen. And so what's going to happen apparently is we're going to have a spike in it. It's going to start to seem like it's going down, and then it's going to hit in the fall. So this is basically supposed to be the calm of the storm. And if this is the calm, I'm really kind of there to see what the storm is going to be like. But there is evidence to suggest that once you've contracted coronavirus and beat it, now you have the antibody to make sure you don't really ever have to deal with that particular version of the coronavirus again. So that's reassuring.
Is there different versions of this COVID-19 that people are dealing with? Like, are people getting different strains? Because I think I spoke to you by text earlier. It's like I feel like in January I had respiratory issues. I was having a problem breathing. I felt sick as a dog. I was very tired. I couldn't. I didn't want to get out of bed. I was so congested. My taste was off, and my hearing was off. And the hearing was like kind of like the most distinct symptom to me, that like my hearing, like I always felt like I was in an airplane and having to pop my ears. And then I knew like 5 other colleagues that had the same symptoms. It was all like early January, maybe February, and nobody, I sat it out. I didn't go to the hospital. I didn't, I tried to fight it out. I guess my symptoms didn't get as severe where I would need a respirator or something like that. I just felt shortness of breath. I had to take a break from, my medications or whatever that I was puffing on and everything else. And then it lasted like 10 days. And I don't know, maybe it was just a bad cold. It could have just been a bad cold, but it did feel different than other colds. I was laid up for a while. If that in fact was corona, which would be my hope, is that I did get it, my chances of getting it again would be, for most RNA viruses, are there RNA viruses that you can, recontract after you've already had it and fought it off, or is that
Well, I'm not sure about all RNA viruses, but I know in particular what we're dealing with. In fact, one of the clinical trials that we're in right now is to use the serum of somebody who has had virus knowingly, and to use that, see if it's going to help the next person fight off the virus, to kind of give them the antibodies to it. So the idea is, yeah, no, once you contracted the virus, you shouldn't contract it again or have that. But what we can tell this particular COVID-19 is that in some people, the symptoms come on and they have a little what appears to be like an illness, and then they go away, and the person starts to feel better, and then they come back and hit harder than they hit before. So I mean, what interesting about what you just said, that one of the things that are coming out of the European studies and some of the anecdotes that you're just talking about is, for some people, the symptom is lost to taste and lost smells. So I think it's interesting that you mentioned that, because when we're experiencing the influenza, that's rarely claimed, is loss of taste and loss of hearing and things like that, unless, of course, we've given them an antibiotic that the side effect happens to be that. So, yeah, that's interesting. Huh. Well, I hope you're immune to it, because then you don't have to worry. So are you the type that would want it? Like if the doctor said, hey, well, Jamal, why don't we draw blood and test this to see if that actually was COVID-19? Want to?
Yeah, I would. I mean, I would do it right now. I mean, I'm definitely a fan of science. I mean, I hate that there's so much politics involved in science right now. It's like it's saddening to think that science could be so manipulated by some political speaker box or whatever. But I mean, I would love to. I mean, if I did have it, if I could be tested and they said I did, and my blood or plasma could do something, or antibodies, I would gladly do that. I would, on the other side, be hesitant if now the solution is that we have to get a COVID-19 shot every year, which all those type of shots scare me, just like flu shot. I always like, no, I never do it. And I wonder, like, if that became protocol, if that became something that you need to do to travel or whatever else, how that would like affect certain, people that are just very hesitant towards getting those type of vaccinations, so to speak,
Oh, definitely. I mean, out here in Hollywood, I mean, these stars aren't talking about it, but they, Corona is ripping through folks and entertainers and things like that. And so one thing that we know is that vaccination had been falling off. People want to do it, but they're scared of it. And so what's happening, one of the backlash that we'll see, and some would see this as a positive, is that now people are so afraid that those same people who were hesitant to flu shot, don't want to take the vaccine, well, when's the vaccine for coronavirus coming? So I think at the end of the day, we have to always rely on basic science. We have to think about how our bodies are designed to protect us in certain ways, and to not all looking for the next newest vaccine, because we've seen damage come from them. We've seen negative outcomes. So we don't want to just say, okay, well, when is the vaccine coming to protect us?
I would say, in all my reporting, I try not to get, so politically one-sided, because I know my audience is different. But I mean, when you, just as, I didn't even make it to be a medical professional. I was a aspiring medical professional at one time, and went a different way. But even just from that level of doing some studies and whatever, what I heard the president of the United States get up and just tout a cure, basically, as fact, it disturbed me to like no end that somebody could be that irresponsible without the facts and say, hey, we have this. And it made me think that, oh, he must have stock in this drug company or whatever. Now he's a drug dealer. But I mean, like how I know that there's a process, and I know we all wish the process could be faster for finding serums and vaccines and everything else. But I mean, in
Well,
reality,
they want the process to be faster, because what we're doing by wanting the process faster, we're allowing them to take out some of these controls, these hoops that they originally sort of had to go through to even get stuff on the market. And so now, since we're also scared, we're like, anything, just put it on, just give it to me. We try it, and it's sad to see. That's another one of the civil liberties that we were talking about, is that you can use fear to really help you remove everything you thought you knew and replace it with this new fear science that's coming into play. And yeah, when he did that, that was very, very responsible. I agree.
there was a bill passed in the House and the Senate this week that spent, I guess, $2 trillion or $3 trillion and went to certain industries. Where I know that they did a lot for supplies. Well, like I said, they did enough. I know that part of the focus was for supplies for hospitals and everything else. But as far as medical professionals, was there anything specifically in that bill to ensure you guys overtime pay or paying for like all this other stuff? Was there anything specifically for all the medical professionals that we're counting on right now in that bill that said, hey, we know that you guys are extra on overload. Of course, we're gonna give you a ventilator and this, but we're also gonna wipe out your loans or something. Was there anything in there that spoke to that?
No, there's that I know of. There's nothing like that. It's always been like nobody really looks out for the healthcare providers. Like when you go to the doctor and you have to pay a lot of money, you have to copay, and you have to do this, you get all these bills. I mean, very little of that is ever going to the providers. So I think providers have all been so busy trying to help people and save people and do no harm. And as a result of it, we're always getting the short end of the stick because we don't have any lobbies. We don't have any, in that really, really invested in looking out for us. It's really all about money, and I think that's always very clear. Like, look at China, they have a clinical trial on about vitamin C infusions. When people contracted COVID, they were infusing 1,000 grams of vitamin C per hour over the course of 6 days, right? And so they had great outcomes, and people started improving, and so on and so forth. Well, in our country, we're more concerned about. I mean, you can't make any money off a vitamin C drip, So it's you're not even hearing about it.
Yeah.
But in terms of the different medication, the different processes, taking someone else's plasma and putting it in and we're so over medicalized everything that we're at this point where it's like you don't know what to believe, you don't know what to look forward to, you don't know, So as a healthcare provider, I think that's that part that's tough. Like there was a guy in town who got some tests, and he was charging his patients just $250 for a COVID test. And everyone was like, how dare he? How dare he? I was like, well, I mean, he had to pay something for the test. And so is it really that bad that the guy wanted to get compensated for the exposure risk and for the energy that went into the test? So I think it's difficult being a provider. On one hand, you want to help, you want to do as much as you can, but on the other hand, you got kids, you got private school, you got this, you got to pay your own pays when you go to the doctor. So I think all of that really kind of complicates things. And so what I would hope for in our country is that at some point we stop letting the insurance companies run and pharma. Pharma run things. Pharma runs the CDC, and pharma, has its hands in everything. So it makes it really difficult to see what's true, what's real, what's real clinical trial, and what's not just somebody to make some more money off of you.
Yeah. How long do you think the hospitals will be overwhelmed, because I know there's people, there's stroke victims. My own mom had a procedure, which I won't say publicly on camera because she'll kick my butt, but that she had to get pushed back because of this. Like, how long do you think, I know it's no answers, there's no definitive answers, but how long do you think
what happened, right, is that the systems aren't as overwhelmed as it seems like it. Like, they stopped all of this waiting for it. We're waiting for the ICUs to fill up. We're waiting for ventilators to dry up. We're waiting for there not to be space, so we don't do any surgeries. If you end up in the ICU, you might be taking up from the COVID people. So when you're going into these hospitals, they're a little bit more like ghost towns than like chaos and mayhem. So, and that's other part of, I think, where the media is going wrong is saying these systems are overwhelmed, when really I think what most healthcare providers are doing are twiddling their thumbs. And I would love for some to comment on this stream too, who've witnessed it, because it's not, the systems aren't overwhelmed yet. You know, they're not loaded yet. You know, in Italy it looks like that's really what happened, but here that hasn't happened. And I mean, it may be happening in certain neighborhoods in New York City and certain neighborhoods in Washington, but mostly around this country, the hospital systems are not overwhelmed. And I wish they would stop saying it. Wow. Right at this point, as of today.
Wow, thanks for sharing it. I mean, I didn't know that myself, and I'm glad you could bring that perspective to it.
Yeah, people's surgeries are getting canceled, doctor's appointments, you can't go see the doctor. All of that is getting canceled, and when of it, the doctors are around at home watching TV with their kids, just like everybody else is. So, you know, in certain cities, that's not the case. But the majority of America right now, not overwhelmed. The system is not overwhelmed, and CNN just keeps saying it over and over and over again. And I'm like, what? And ABC keeps saying it over and over and over again. And I'm like, I'm in colleagues around the country all saying the same thing. Like, no, nothing happening here. Yeah. So I know that's part of this panic that we want to sure everybody stays in. But whatever it is, whatever the reason is working. You know, it's even got those of us who know better spooked.
Yeah. As a physician, have you been trained on how to perform a test yet? Has there been some protocol or some text message you all got to say, hey, this is what you need to do, you know, this is how you do it, and here are some tests? Or is it just going to certain infectious diseases specialists? Like, how does that work?
That is such a good question. We don't got any trainings. As a matter of fact, we had kits, test kit. We tried to give 40, got 4. So and then they just come, you know, they just send them. They're like, here it is. And you look on the package and it doesn't say anything about COVID-19. So then we're like, so what are we supposed to do? Are we supposed to ram it in the nose? I know it's uncomfortable. It's supposed, you know, potentially spew all over the place. Like, what are we supposed to do with these? So it's funny that you asked us that, because as you know, doctors, we can pretend all damn day, but no, nobody has told us how to use the tests. So.
Wow.
Yeah, wow. No. In a perfect world, just like doctors never take a nutrition class, we never a COVID testing class. That's easy. Yeah.
Sorry. Okay, yeah. With my son FaceTime. Well, I mean, this has been very informative, but I don't know if I'll be able to catch you every week with all the news. It seems like next week you'll be working 24 hours a day or whatever, or maybe not, you know.
You know, funny. I go to, because I'm in a clinic that also doubles as an urgent care, and that's crickets. Like, gosh. And you know, part of that because everybody's like stay home. And so, you know, we're maybe probably in a 12-hour period we'll maybe see right now 9, 10 people. So it's very light. You know, it's people who've cut their finger off while they were cutting vegetables at home. You know, that type of stuff. Yeah. And then, you know, lined up sickness people.
I mean, you think it'll all balance out, like with people staying home? Like, I'm sure Like I think there is like 75 car deaths in California a day. You know, and like now there's less traffic. I mean, people aren't meeting at the bar and having sex. There's not shootouts at the club. I mean, it's like all of this, all these social distancing guidelines, protocols that's kept most of us at home. Do you think that will balance out the random deaths that we have? Not random, or you know, whatever the deaths, murders, whatever happens on the daily when everybody's in the streets doing whatever they do. Do you think the staying at home will, like, with that, between that and the people that actually do die from COVID-19, like be like a even swap or something like that? I mean, I hate to say even, you know, like, do you, I mean,
I think so. I think, you know, like 81% of people who contract COVID-19 recover and do very well. I think the social distancing, I think it can really work, but I think what confuses me about our need to social distance is that we're not putting the extra step on there, saying, you know, since we don't know who has it and who doesn't, since nobody has a test kit and we don't know who's carrying it and who's not, why don't we just cover where the virus would get out of? You know, why wouldn't we tell people to cover faces? So I think social distancing will in fact reduce some of this. But you know, if those numbers they're saying are giving us are true, like should expect to lose 1,000 and 200,000 Americans. I just wonder then, if that's the case, why we're not going the extra step and telling people to cover up. Because if we really want the virus to stop dead in its tracks, I mean, wouldn't we get the people off the streets and then say, well, if you have to come out, please take the precautions. So I think we're going to see a decrease, but we're certainly not going to see a halt, because I could go to the grocery store now and be in line with some people with it and come home with it too. So so we're putting some things in place, but I don't think we're being diligent enough to really wipe it out and make it just stop. So yeah, that piece right there. No,
I thought of some things when I left the school of engineering and doing biomed and went to H&OD. I thought about some scenarios we had, and it was some course I had where it all made sense when this scenario came up, that we should be going to the grocery stores by last name at certain times during the week right now. Like, it should just be like, if you're F and G, you can only go between 6 and 9 a.m. on this day, or 4 and 5 p.m. on this day, or such and such, just to reduce and keep people in a somewhat controlled pool body where, you know, if it's an infection, you could kind of track them down instead of randomly. Do you think like any of these protocols would ever come into fruition? Because I mean, I think grocery stores should be like last name right now. And
no, we did stuff like that. Like, I mean, that sounds very, very Korean. Like I could see Koreans doing something like that, because what did they do? I mean, they're tracking people with cell phones. They want to know who has it and who doesn't. If you have it, you go home. You leave outside your house. We're charging you $8,500. You know, so what you're talking about is kind of more of a strategy that fits into that country situation. I think here in the United States, you know, we have a lot of we have a lot of liberties. You know, it's a democracy, it's a free country. So there's a struggle between should the government be doing more, you know, saying staying home, we're going to arrest you on, you know, you hold church jail, you know, all of that, versus, because we know that if that happens now, the sickness, those type of policies carry over, right? So if the government can tell me to go to the grocery store on Mondays, well, then, I mean, are they going to keep telling me after this? When does it stop? Especially since this coronavirus is not going to stop. So I think that the piece that everybody struggles with, I think the Democrats want more of that. You know, they want more policing. They want more stay home. We will arrest you if you come out. Let's track these people. Let's go to the grocery store on Mondays if that's things that. But I think the Republicans are more along the lines of, hey, that's government getting too involved in everything. And then that's just a little bit much. So that becomes the struggle of how do you balance this infectious disease, and how do you balance policies? Well, what you do is you make everybody very scared, and you make them fearful, and then it takes care of itself, right? Because now we're calling like, my neighbor needs to stay home. Now, then they have hotlines to report neighbors who are leaving the house, So I think what we have to keep in mind is that there is a low death rate here, that 81% of the people recover, that a lot of what on the media is scary, but it's not really necessarily all that. We've all had Facebook friends and families getting sick, and they're living to tell us about it, right? They're telling how terrible it is. Don't let the fear of that help us railroad into a situation that we can't back out once it's in place. So I think that that becomes, for me, as a mom of kids who have a future here, as a provider, as a Black woman, and so those are all of the things that I struggle with every day. Is what's too much policing of this versus how much of this should just be personal responsibility. But I think you leave the door wide open to continue to have these conversations if you don't cover their face. Because it's just going to keep spreading it. It's just going to keep going around. But that's probably a little bit too much politics for conversation on COVID-19. But I struggle to find a way to have a conversation about it without talking about the politics and the implications. What our future is going to be like if we allow this to make us act like China and make us act like India. I mean, India was beating people that came out of church day, and it was legal. So we already have a very, very overly institutionalized prison system, and I can never separate something like this in terms of thinking about it long terms in terms of incarceration. So now are you going to go over and stop me because I'm trying to go to in and out at 2 o'clock in the morning? I mean, is that really where this is headed? It is headed there. It is headed there, but should it?
Yeah. Well, I appreciate this, you sharing this with my audience, all this information. I hope we could do this. I'm not going to say every week and everything, but we're just going to play it by ear, and when you're available. I mean, the weird thing is the last time we hung out with Rihanna. We could really say that. We were hanging out with Rihanna, and now we all social distancing and can't even be in each other's presence. But I miss you. I love you. I thank you for all the knowledge and everything, and being like a hero. I know it's Healthcare Workers Day, and it's a day to celebrate. But I really think you're great every day, and I appreciate you. And hope we can have more of these conversations, because I can't just listen to this guy on the TV talk about this stuff, and all I keep on thinking about is the Sharpie in Alabama and the hurricane, when he just, is.
No, definitely. I hope we can do this, because this was fun. So I appreciate you, and I appreciate you sharing all this with your audience, because your voice that they look for information and entertainment and all of that. And hopefully we've given them information and entertained them. So hey.
Yeah, and I'm sure you're doing more stuff on your YouTube and your Instagram. So everybody, make sure you just watch it here on my channel. Go follow Dr. Rachael on it's RACHAEL on Instagram, and you follow her on YouTube and everything else, so you can get this information. Now, I'm gonna try to tap in every once in a while, just share it with you guys also. But you're always there, and keep on doing stuff and take care of your beautiful family. And I hope everybody stays clean and showered up and wash their hands. And it's easy for me, because like now I'm alone in this part of my life, so all I have is a turtle, and he's sitting in a 48-gallon fish tank saying, "What's the big deal? I've been on quarantine for 4 years." So I'm just sitting here, just me and the turtle, and it's it's easy, but you know, I miss
Sir,
my
all
kids.
along, I'm going to remind you, still wash your hands, Jamal.
I wash my hands all the time.
Okay. Very, very good. All right. I'll talk later. Thanks again.
Thank you. Bye.